CIRSE in 2021 offers a huge range of different specialties within interventional radiology, from aorta to peripheral arterial disease, interventional oncology, embolization, venous, dialysis, you name it, it's got it all. So there's something, no matter what part of interventional radiology you're doing, you will find an area of interest in our meeting this year. One of the most attractive aspects of the traditional CIRSE meeting is the ability to engage with experts on a one-to-one basis at the time of their presentation and immediately afterwards. When you get to ask them one-to-one, you can go off for a coffee and ask them a specific question about a patient that has been troubling you. And the best way to achieve that experience for you this year is to engage in the live meeting, where you get to ask questions online. You type them in on your computer, they will be sent to the faculty, and they will be answered by the expert. So it's very close to the same experience that you would normally achieve. And this year, I suppose, from my own personal point of view, there's so many different tracks of incredible interest. But I think you'll find your practice will be affected by the sessions that you can attend live. This year, as part of the scientific program committee, we put a lot of effort into getting what you want as an interventional radiologist out of this meeting. So for me, one of the highlights is going to be on day one. There's an incredible amount of live, real cutting edge stuff in peripheral arterial disease. Specifically, there are hot topics in acute limb ischemia, in acute mesenteric ischemia, in deep venous arterialization in no or in desert foot patients. And then obviously there's this huge focus on drug-based technology. Is it good? Is it bad? Should we be using it? Hear the experts, hear what they have to say. This kind of information will inform you to make the best decisions for your patients at home. Obviously, the entire Congress experience has changed considerably since the last time we met person to person at CIRSE 2019. One of the big changes has been the availability of on-demand lectures. These are, having participated in some, I can tell you that the standards are exacting. They are really, really high quality. And the amount of effort that goes into them, in my view, is extraordinary. So therefore, the amount of information that you, as a participant, can gain from them is equally excellent. Once the Congress is actually over, you will have the ability to access all of the on-demand material for quite some period of time. So our lives are very busy. You often don't have time to attend the live lectures. We understand that. We have the same busy lives. But you now have the ability to look at top quality lectures with a really high educational content for some time afterwards, at a time that suits you in your lifestyle. Management of aortic pathology has always been a mainstay for interventional radiologists. And we've addressed that, we hope, very specifically in terms of the on-demand lectures available at CIRSE 2021. For me personally, I'm very much looking forward to the management of endoleaks. This is an ongoing problem in my practice. Every single week at the vascular MDM, we have the same issues. How do we approach this endoleak? Which ones can we leave alone? How should we attack it? Should we embolize it? Should we direct puncture it? If we do direct puncture it, what should we use? So I want to learn from this. In terms of pediatrics, to shift focus completely, you'll find that there's a fundamental course outlining how the IR suite can be best optimized. And it's quite cleverly labeled. It's not just small adults. When you go to Great Ormond Street or you go to any of the great pediatric institutions around Europe, you see that things are set up differently. And although you may not have that much pediatric interventional radiology, there are times when you all have a bit of it. And it is worthwhile to learn from the experts as to how that can best be applied. Personal interests, venous intervention is obviously very close to my heart. And this year I'm honored to be joined by a colleague who is Karsten Arnoldussen, and we're doing a fundamental course on lower limb deep vein thrombosis, covering, we hope, every aspect of it in 1 hour of intense focus. And I think that regardless of whether you're interested in venous or not, you're all going to be faced with some venous cases from time to time. And we hope that we can improve your patient selection diagnosis and management by attending this lecture. But there are lots and lots of others that have got the same value and perhaps are much more up your street. And I think that if you look at the totality of the educational experience that CIRSE 2021 offers, it is fantastic. It is by far the best online interventional meeting in the world.